Thank you for Thank you all for joining us today, and thank you to our partner in today's Lunch and Learn, Mercer County Behavioral Health Commission. Today we are talking with Katie Gassner. Thank you so much for joining us today, Katie. Katie is a certified tobacco treatment specialist who collaborates with community members, businesses, schools, healthcare, and private organizations to challenge long ingrained cultural norms regarding tobacco. Through policy change, advocacy, and education, Katie encourages layering no-cost Pennsylvania initiatives with shifting norms to create a healthier society for everyone. Today, Katie is going to talk with us about advancing our community's approach to addressing vaping and tobacco use disorder. So Katie, I will go ahead and turn it over to you. Thank you so much for joining us today.
Thank you, Donna, for the opportunity. Hi, everybody. For anyone who I have not had the pleasure of meeting, service provider for nicotine-free Northwest PA. If you like something that you hear today, I'm happy to connect, and you can find me at Mercer County Behavioral Health Commission in the prevention department. So let's get started. So I can imagine that everyone has had a busy morning. At lunchtime, you are probably eating or trying to multitask, check those emails. Life is busy and things are constantly contending for your attention. So before we begin, I'd like each of you just to do a really quick self-check. Think about how you're feeling at this very moment. While you're trying to put a name to that emotion, I'm going to ask if you could take a big, deep breath. Take it in through your nose, out through your mouth. One more time. Smell those roses, big through your nose. Blow out those candles, out through your mouth. Feel free to keep doing that if you notice that you like how it makes you feel. Because when we feel relaxed, our brains feel primed and ready for new information. Our brains are broadened, they're able to build and explore new concepts. So hopefully in our time today, that's where you can find yourself in that space. But I'm sure, as we can all guess, that the opposite is true when we're stressed, anxious, or overwhelmed. And it's hard to retain new ideas because we know our brain is in that fight or flight mode, and it's really narrowed and limited. So unfortunately, if you find yourself there today, you just keep on doing that deep breathing and hopefully you can join us later. But for everyone else, I hope you feel pleasant and you're ready to retain some new info. So we're going to kick off. I'd like to introduce you to Heather. So Heather, she is an individual that I met at a drug and alcohol outpatient group. This was a group that was meeting 3 days a week, and the therapist had asked me to come in and share some resources because she said many of the people in the treatment group had really talked about wanting to make some changes with tobacco use disorder. So Heather must have known I was coming that day because as soon as I walked through the door carrying my little grocery getter cart with information, she energetically starts waving and stood up and she shared, she's like, I haven't smoked in 4 weeks. You could see the proudness in her voice and you could hear it in her words. And she had a great big smile. And of course, my reaction was the same. I echoed that. I was very excited and happy for her. And the group immediately had all their eyes locked on Heather. And they started asking her, they're like, Heather, how did you do this? What are you doing to get through this? And so she shared with the group that she had been using the nicotine replacement patch. Her doctor had referred her to the Pennsylvania Free Quit line. They mailed her 8 free weeks of the nicotine replacement patch. They also could send the lozenge or the gum if she would have had interest in one of those products. It came right to her doorstep. She didn't have to go anywhere. It wasn't charged through her insurance. And then she said she participates in weekly phone counseling sessions. And she does that once the kids all go to bed, and she spends her 15 minutes once a week in the evenings talking to her own personalized tobacco treatment coach. She said, it's wonderful. It's no cost. I can do it right from home. And she just said, I am ready for change. And that's what motivated me to get there. So her response actually falls right in line with the research. I don't know if you know, but 7 out of 10 people with behavioral health conditions, they make at least one recovery attempt each year. And this is so great because we know treating tobacco use increases behavioral health treatment outcomes. So back to that group. That group was busy sharing all the things that they've tried and things they've worked on. One person raised their hand in the group and she said, my sponsor told me that I shouldn't try to quit nicotine right now. So my emotional brain, it wanted to scream. But the reality is, this is really truly what some people have been told. especially during the years that big tobacco companies were funding mental health programs. We know that cigarettes were once written into treatment plans for patients. And when substance use disorder treatments were talking about going smoke-free, they were offered money by big tobacco companies to still allow smoking at their facilities. So with all of this information out there, we could see why some people could maybe see why tobacco use is maybe not the right time to be dealing with it. But instead, we should really try to focus on the facts, like the ones that you see on the screen. We should be able to share the research, the science, the outcomes that we know that when we're working in treatment and it's person-centered and we're focusing on wellness, that the majority of people who do address tobacco use disorder at the same time as other substances have amazing outcomes. We see that there's a decrease in depression, anxiety, stress. We see improved moods with individuals that have started to make these changes. We see self-confidence. And the best part of all, the last one on there, I love that we see enhanced long-term recovery. And isn't that our goal when someone's in treatment? So please encourage, if you know anyone that is still sharing that information, encourage them to maybe revisit the information that we have out there and available. All right, so back to our friend Heather. So during this group, one of the members had asked Heather what the hardest part of her tobacco recovery has been. She got really quiet and I wasn't sure what she was going to say. She got teary-eyed, she lowered her head and she said, honestly, it's here. You could hear a pin drop on the floor during in that treatment group. She explained that, you know, nobody in my family uses tobacco. Everyone here does. When I drive in, everyone's outside standing by the door smoking. I see vapes in people's hand during our group. Then halfway through our 3-hour session, we stop for a literal smoke break and our therapist goes outside too. She said, I feel anxious, I feel left out, stressed, and just not really sure what to do with myself. So driving home that day, I was so heavy-hearted. I kept thinking about how is a system that is set up to help causing the most amount of stress and difficulty in this person's recovery. So think about that first slide when I said, if Heather's brain was stressed and anxious and narrowed, do you really think that she's able to retain and take on new tools and coping strategies? Because she was there for drug and alcohol treatment group. Probably not. So then I think about this from another lens. Imagine if this was alcohol instead of tobacco. Imagine if when Heather drove up to her treatment group, alcohol would not be in plain sight. The fresh air breaks would not be called a beer break. There's policies in place for businesses that prohibit alcohol on the property. So why is that such a tough sell when we're talking about tobacco? So for too many years, if you think about, we have kept tobacco use disorder over here in its own silo, separate from other substance use disorders. But why? I ask you to really think about, why have we done that? We have medical professionals and therapists that are amazing. They're talented and quite capable of addressing tobacco use disorder. We on the call, we're smart people. We understand facts. We know that tobacco is the leading cause of preventable death. Every health condition is made worse by tobacco use. So what is the hesitancy? A very respected colleague of mine, Tony Klein, shared with something the last week that has stuck with me. And I felt like it really resonated, and that maybe for some of you on the line, it would help too. He said to me, he goes, we have to meet a patient where they are. Although that is true, we have to do our diligence not to leave a patient where they are. Even if a person does not think that they want to stop using nicotine or tobacco, we can't use our personal biases to make that choice for them. We need to have opportunities available for change. We need to verbalize options for them. We need to offer it. And if they say no, they say no, that is fine. That's their personal, that's their response and their right to do so. But we can't just not address it because we think, oh, they're going through so much right now. Because that's kind of what's happened to our marginalized community members over time. Big tobacco has targeted certain racial aspects of our community. Now they're targeting our young youth leaders. They're being subjected to vaping and high levels of nicotine. And they're Young brains are being primed for nicotine use, which is only going to further perpetuate this tobacco narrative that we've been living in. So to begin to denormalize tobacco use, we really have to start to redefine it. We have to think of it more as a social and cultural problem with an individual addictive component. And that change, that can start here today with just a few of us, but we need to get that information out to everyone. And that's where I'm going to ask for your help. So our first action step, you don't have to leave your seat to do it. It's not going to cost you anything. You don't have to wear one more hat at work. It's just to simply think about, how do we talk about tobacco? So shifting our cultural norms is going to be a really heavy lift, but it can be done with some gradual change. And we're going to start today by trying to reframe some commonly used terms that are used in daily language. And together, we're going to work on trying to establish tobacco as less of a norm and more of what it is: a disorder that is chronic. It's a relapsing condition that really warrants treatment consistent with our chronic disease model. So instead of calling a person by their actions, we're not going to call them smoking, smoker. Let's try to call it what it actually is. It's a tobacco use disorder. And a person with tobacco use disorder can find benefits from behavioral interventions and medications, just like any other substance use disorders. So moving on, we're going to talk about, nobody was raised a quitter on this call. I know that for sure. So let's talk about recovery. And our treatment groups, our members set recovery start dates. That's the day that they begin healing. No one wants to give up anything. They actually get excited when they talk about a recovery start date. They think about what their future self is going to look like tobacco free. They think about getting healthy. So try that. Just try the words out, see how they feel. The reaction when you see people look at it that way, they like it. They like to call it a recovery start date. So the other thing I often hear in our groups, I hear someone say, smoking is my bad habit. That really implies a choice. And it's not. We know it's a clinical disorder. And so we really need to start recognizing that as a chronic disorder that's relapsing, we don't want people to think that this is a bad choice that they're making. Instead, we want them to recognize that there's a lot of components that go into this brain and body disorder. And let's start to work at that. The other thing is cessation. Guys, I don't know about you, but when I started, I could barely say the word correctly. I didn't really know how to pronounce it, or let alone know what it was. So in the community, as you can guess, if I advertised I was having a cessation group, people would be like, what is that thing? So let's refer to it what it is. We're having a tobacco treatment workshop. We're having a group. We're having an opportunity where we can come together with like-minded people that get what you're going through to make some changes. Because at the end of the day, the word cessation, really, it's false to think and expect that someone's going to join a group one time and that all of a sudden they're going to cease from use and it's going to be immediate, because that's not how it works. The other thing is, when we're thinking about e-cigarettes and vapes, they fit all into these same categories, and groups are available for any type of tobacco use disorder. But I really want us to try to focus on not glamorizing e-cigarettes and vapes any more than they already are promoted by the Instagram people that are out there for our young people to see. So it's not a fluffy white steam cloud that's safe. We know that it's a chemical aerosol that people are inhaling. So with just a little change in our words, I hope that we can all think of the Heathers out there next time we go to say one of these words, because, you know, Heather was on her path to recovery, and unfortunately, treatment was the most difficult place for her to be. But if together we start to work as a community, we can be supportive where someone may need it, and we can start with our words. And that can be an action step for today. But speaking of words, I just wanted to share a little bit about something that some groups in our community are doing, and I'll take just 2 quick minutes to applaud 2 of our partners that we're working with, and they're stepping up and taking action right now. The CDC has provided PA funding for a statewide tobacco-free recovery initiative. So the purpose of this funding in this work group is to focus on culture change, specifically in advancing tobacco control policies and clinical intervention and be the behavioral health population. because we know that's the highest rate of tobacco use. So both Community Counseling Center and Alpine Springs Rehabilitation and Recovery Center, they have raised their hand, said, yes, I will be a part of this pilot. And they've been chosen and accepted as our Northwest representatives. So I think this is really huge for our community because we have one of the largest drug and alcohol substance use providers and a detox and inpatient substance abuse treatment center that are prioritizing how they address tobacco use at their locations. And this is going to help set up the foundations for moving forward for across the state. So I love this. I'm thrilled. I wanted to share that, and I can't wait to see how this unfolds. And I know many of you on the call and in the community are also prioritizing tobacco treatment, and I congratulate and I applaud you. Keep it going. I love this work that you're doing. So I want to keep you guys on your toes, ready for action step number 2. So this one's an easy one. I just would like, my request today is help me share. Help me share what tobacco treatment actually is. So we already learned that we are going to try and not call it cessation, step 1, right? Because no one knows what the heck that is. But let's keep talking about what tobacco treatment is not. So tobacco treatment, it's definitely not a place for shame and guilt. We have no room for that. When we're trying to broaden and build, again, those pleasant feelings, that's what we're looking for. And we want that tobacco-free life. We need to really think that there's no spot. We can't shame someone to making change. That's going to not make them want to change anymore. Plus, those feelings just aren't helpful. The other thing about tobacco treatment is it's not judgmental. Everyone has a different path, whether it's your first attempt or your 500th. There is support out there for you in our groups with the Quit Line or with other resources that are available. The other thing that I wanted to share is that tobacco treatment is not just for an everyday pack-a-day tobacco user or someone that is smoking. This group is meant for anybody. We want someone that's using cigarettes, someone that's vaping, someone that's a social tobacco user, a weekend warrior, only has a couple every few days. You're invited to this. Every single type of product, we would love you to join us. You're all welcome. Tell your friends too. We'd love to have you. So this is one of my favorite reminders. It comes from smokefree.gov. If it doesn't work, there are 25 other letters out there. Let's learn and let's keep going. Isn't that what we call practice? So individuals had to learn and to practice how to use tobacco. So let's recognize it's going to take at least that to make some changes. So when I said smokefree.gov, this is what their website looks like. And it's probably my favorite one-stop shop. There's 6 categories you can see at the top of the screen. However a person chooses to identify, there's tailored information. There's free apps that you can put on your phone. You can get free text messages that gives you support right when you need it most. There's links to Facebook groups. It is by far one of the best websites that are out there. All right, so how are we doing, guys? Any questions, please type in the chat box as we go. We'll save room at the end. I'm gonna have you take another big, deep belly breath. Maybe I need a breath, so I'm gonna do that. All right, get ready, because I'm gonna push some anger buttons as we're moving forward. So I need you to be as relaxed as possible. Okay, so remember how I mentioned that the tobacco and the vape industries have really targeted some racial and ethnic minorities over time. One of the well-known tactics back in the 80s was they saturated Black and African-American communities with free menthol cigarettes. There were coupons for buy one, get one free. They were giving them away free at some locations, very, very low pricing. So along with the ads that they were promoting in the area, they made the product seem like it was less harsh. And it's no surprise that menthol products were appealing. And then of course they were quickly picked up in the community and by young people. So I just want to take a minute to dispel some long ingrained myths about menthol. It is not less harmful. Studies show that using menthol may make it more difficult for someone to to quit compared to someone who is not using menthol. And then the other thing that this leads me to is if we want to be able to talk to people about making change, we got to at least have a little background working knowledge of what products are out there because it's ever changing. So I'm going to do my best to give you like a quick overview of the products that are out there. So we're going to start with combustible tobacco. Combustible just means anything that you light. So under this category, we're talking mainly cigarettes, cigars would be combustible, pipe tobacco. But so this would be one form of a tobacco product. Another is smokeless. We sometimes hear that as chew, chaw, spit tobacco. We've seen over the years it's changed form from a smokeless tobacco to now it comes in pouches in a variety of different flavors and menthol and other flavors that can be available. Does anyone know, put in the chat box, do you know why the invention of the pouches, like what started that? Like what was the reason for that? I'm going to come back around to that and see if anyone knows. The other thing, cigars. Cigars, those black and milds, super popular amongst our young people. And, you know, some people, even as older adults, don't realize that a cigar still means that you can have a tobacco use disorder or that you have an addiction to nicotine. So one of those little cigars is equal to about 5 cigarettes in comparison to the amount of nicotine that's in them. The cigar itself is made of a tobacco leaf, so that too also increases the amount of nicotine a person's getting. So that's our basic level tobacco. Those are things that, you know, probably you've heard about before and you're pretty familiar with. The next category has been something over the last, I hate to say it already, like 10 to 15 years that have been in our communities, and that is ENDS. They're electronic nicotine delivery systems. So that's the large term that underneath the umbrella, we have what we most commonly hear people refer to as vaping or e-cigarettes. So under those are a couple categories. We have the type that are refillable. So those would be something like you would have an e-liquid and a person could add the e-liquid themselves. We have pod-based. So a pod just means it's typically pre-filled. You would just go to a convenience store or online and they sell a pre-filled pod that you get and you would click into your device. And then we also have disposables. So disposables on the end would be the ones that are, you use them 200 to 400 puffs, depending on whatever the brand may be, and then you toss them. There's no battery charger for those, a lot of waste, but you use them and then toss them out. So if you have any questions about these, let me know. But one of the things I just want to make really, really clear that as all these new products keep coming out, our laws are trying really hard to keep up. But think about this. Originally, the FDA was regulating cigarettes. Then they had the power to regulate more products. So we went to cigars. Then we added on the list e-cigarettes. So e-cigarettes at first they were able to regulate, but then we got the disposables and that was out of the loophole. So every time new products pop up, we keep hearing that our laws aren't able to keep up as fast or that the FDA doesn't even have authority over these new products because they weren't on the scene. Well, hold on to that thought for a minute. All right, next question for you. I need to know how many out there in the chat box time. What do you know? My son is using tobacco-free pouches. Tobacco-free pouches. Isn't that better than chew? Yes or no? What do you think? Oh, but if you don't know, that's fine too. I'm going to help you know. So this is a slide that has the most words on it, but it's also maybe my favorite slide because this is probably the best 2 minutes of the presentation in my eyes. I want to talk and think about if someone said a tobacco product, like we just were talking about on that previous screen, you immediately would picture those first 3 products, right? Maybe some cigarettes, cigars, smokeless, pipe tobacco. You probably knew that that tobacco originally came from a plant. Then, of course, it was reconstituted with over 650 additives to it and chemicals to make up the products that you would find sold at your local grocery store, convenience store, and going way back, vending machines, which are now illegal. But big big tobacco companies, they released variations and called those products over the years lights, 100s, slims. They had a menthol version. All of this was to market and make more appealing to larger audiences, right? Okay, they acted like these products were different, safer, but they aren't. They weren't. We know that. Science research, we know that all of that were false health claims. Then we see e-cigarettes. Like I said, that was a category under the ends category that we just looked at the previous slide. When the e-cigarette first came on the market, tobacco users were, they were using tobacco-derived nicotine. Okay, tobacco-derived nicotine. So that means some of the nicotine was coming from an actual tobacco plant. However, nicotine salts and other chemically manufactured additives were primarily used to go into these vapes. So advertising words were used like fruity extracts or fruity flavors extracted from a tobacco plant, tobacco leaf free. All of these claims were keeping the public very confused, right? Confusion on, are these safer? Are these not? How much nicotine's in them? I don't know what milligrams I was using before. All of this leads us to the same path, the same result. Claims of safer does not mean that these products are safe. We know that there is no safe amount of nicotine for a developing brain. Now, if you walk into a convenience store, scroll through TikTok, online markets, you're going to come across new products and you're going to see something to our third category. You're going to see things that are labeled tobacco free. You're going to see a theme here that it says alternative to smoking, tobacco free nicotine. Come on, people, follow the theme. We are in the era now of synthetic nicotine, and we know this is just another marketing ploy. Many of these products that we're seeing that are synthetic nicotine, this means that they were created solely in a laboratory. They're not derived from tobacco. Many of the chemical methods used by companies like Puff Bar, who is using synthetic nicotine, the process is unknown. More research needs done. Again, newer products, newer process to even learn of the toxicity of the synthetic nicotine. But the biggest takeaway from this, please, 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 tobacco free is not nicotine free. Unfortunately, that is just what the companies are using. So I wanted to show you kind of a quick what I was talking about. This is the label from a product, a common product named Zyn. On the top left of the screen, it has a description of the product. You see how it's advertised. Zyn's tobacco-free pouches, a fresh new way to enjoy nicotine. But the thing is, 3 milligram and 6 milligram, that's high concentrations of nicotine. We know that in a cigarette, there might be 4 milligrams, but only 1 is absorbed. So I know this is a whole lot. We're going kind of down a rabbit hole here with this, but really what I want everyone to understand, and the point to drive home, that if you have someone say to you, well, I switched to a tobacco-free product, make sure that it's nicotine-free as well. If not, they're just getting the same, they're still getting all the harmful chemicals of nicotine, but they just might not realize that they're using that product. The Stanford paper found that synthetic nicotine is widely available, and it's even on platforms that prohibit tobacco sales. So think about like online marketplaces like Google Shopping, Target, eBay, Amazon. They have been selling synthetic and tobacco-free nicotine products, and that is how, however, it's illegal to sell tobacco products. So there's that gap again in knowledge, in law that prohibits some of these sales. All right, so we all got it. Tobacco free does not necessarily mean that it's better. It doesn't mean anything. Nicotine is nicotine, and there's no safe amount for a developing brain. All right, everyone's still doing okay? So speaking of our developing brains, I want you to meet Mariah. So Mariah is at the start of the pandemic. Mariah was finishing her 8th grade school year. So it turned virtual, and over the summer, she had spent a lot of time alone. She was home watching her baby sister because her mom was busy working 2 jobs. But Mariah's older brother, he would come and go in the house as he pleased. She always noticed he was with his friends. They were vaping and acting like they were so cool. You know, Mariah, when she was home, she spent tons of time alone, and she spent some time on her phone. So when she would scroll her Snapchat feed, TikTok, and all of the other social media platforms that she was viewing, she would always see bright colors, pictures of people being happy, and kids that looked very popular and like they had a lot of friends. And that spoke so directly to her because that's what she wanted. Instead, she's home by herself, feeling isolated from others. And when it was time for her to get ready to actually go back to school, she was anxious. She was anxious because during COVID, she missed that chance to go to high school orientation. She felt kind of disconnected from other people, and she felt really alone starting her high school years. So one day after school, she had a bad day. She was home, and she noticed that her brother had left his vape in the bathroom. So like all curious kids, Mariah picks it up. She tries it. She kept trying it. She kept it. And then she just decided, hey, this isn't so bad. It didn't hurt. At first it hurt her throat, but then she's like, it's not that bad. It doesn't smell bad. She felt like she was getting away with something. And she felt a little bit, the pool, when she used the nicotine, she felt a little bit dizzy. So she decided on her walk to school one day, she would talk to the kids that always walked in front of her as a group, and they'd always be sharing a vape. Because we know that that's that culture around individuals that are vaping. They share their products. They're always willing to offer it to somebody. But the one kid told her, he's like, listen, when we walk by, I'll show you right where you can go in. This kid they'll sell it at the store. Even though you're 15 and the law says 21, this guy will sell. So sure enough, Mariah goes in there. She gets her own vape. It's in her pocket. Now she knows exactly where she can get her own. But one of the things I kind of wanted to draw your attention to, that these are the ads during the pandemic that were all over social media. Stay home, stay safe, stay home, avoid crowds, practice social distancing, wash your hands, avoid sharing your device. This part, the solo break, if you don't tell me this is targeted directly to teens, how is it not? We know that the inside vibes have been quite a challenge. Stay sane with Puff Bar. This solo break, we know you'll love it. It's the perfect escape from back-to-back Zoom calls, parental texts, and work from home stress. Parent text, clearly this is targeted and sending out a message for our young people. So she was seeing all of this. She had a lot of alone time. She wasn't sure what her school year was going to bring. Now we have her using the product, buying it, carrying it with her to school. And like all things, good kids make bad decisions sometimes. On January 23rd, Mariah made a bad decision. She brought her vape to school, used it in the bathroom. And unfortunately, or fortunately, today's way of handling bad decisions is not writing, I will not vape 200 times on a chalkboard or on a piece of paper. What it is, however, her district runs a program called In Depth. Instead of sending a youth home out of school where they're going to fall further behind and vape more, Mariah had to attend a group while she was in school suspension. It's 4 sessions. During the group, they look at I want to share with you some of the connections that she made, and it's astounding. So here's an opportunity. If you're school personnel, reach out to me. Let's talk about how we can get this going. It's free. I'll help you get it set up. And we have some other locations in our district, in our school district area. Mercer is offering this to other schools as well. And I'd be happy to share their process and how they got this started. So Mariah realized during the pandemic and that she was struggling, that it might also be something to do with mental health. So I want to share this video because I think this is phenomenal. It's one of our newest from the rescue agency. I'm going to go ahead and see if we can get this to play.
Some days you just feel off, anxious, low, on edge. And vaping nicotine can make days like this worse and more common. Because nicotine throws off the natural balance of neurotransmitters in your brain, like dopamine and serotonin, which affects your mood. So you feel more unhappy and less like yourself.
Are you okay?
Yeah, I'm fine. See how vaping can mess with your mental health at behindthehaze.com.
So when we're talking about mental health in our teens, we have seen that during this pandemic and now following, a lot of our teens are struggling. And instead of reaching for a trusted adult or a friend that can help them, they're reaching to nicotine. They're reaching to a distraction because they think maybe this is going to be helpful. Maybe this is going to help change the way that they feel. But for all of us, we understand that that's actually what's making them feel worse. It can make them feel constantly stressed. They can feel preoccupied. And then they just kind of keep their body in this cycle of stress. Let's look at what that might look like. When Mariah is experiencing how nicotine reacts in the body, this is a cycle that kind of happens in a day. So with someone that's using nicotine, we know that they'll wake up in the morning craving nicotine, so they use it. So then the body, it feels better, it feels satisfied for a bit. And then anywhere from 20 minutes to 2 hours, those feelings return again. The anxious, looking for some sort, your body's looking for nicotine. So then we have a person that adds nicotine to their system and they feel better. And the cycle continues on throughout the day. In the middle of the slide, you can see our symptoms that are associated with nicotine withdrawal. Please tell me, can't you see all of these: anxiety, depression, insomnia, difficulty concentrating, anger, frustration? All of these things could be symptoms of a teen that's struggling with mental health as well. So when Mariah saw this in that in-depth group that she was participating in, when she saw the connection and realized this was what was happening to her brain and body, that when she vaped, this is the cycle she was going through, she watched those videos, she realized these are the things that I'm experiencing. On her social media feed, she saw this video. I'm gonna play it for you real quick.
Hey, let me ask you something.
If I put a little arsenic in my cow's water every day, would you drink its milk?
All right, so what if I put some lead or formaldehyde in its food? Would you eat its meat?
Probably not.
Because they're toxic. Even small amounts could cause brain damage, lung disease, or cancer. So if you wouldn't let a cow drink it or eat it, why the heck would you inhale it? Look, vapes contain these toxic chemicals and more. Learn more at downanddirtylife.com.
So although Mariah is not a farmer, that frog in the jar really stuck with her on that one. She said that this was something that she had no idea these toxic chemicals were in vapes. She didn't really put 2 and 2 together and never really thought too much of it. I wanted to share that ad too, because recently we were working with some different teen groups in our area, in our community, and running some focus groups. And they chose this ad. So coming to theaters near us in Mercer and Lawrence County and throughout the Northwest region, we're going to see this Behind the Haze Spilled Milk clip is going to be showing at our movie theaters, along with a clip for adults as well to get access to resources. So it was really cool though, that kids that participated in the focus group, they had some input in how to make some changes. So let's get back to Mariah real quick. So she was talking during being able to see these videos, going through a group, she saw that change is possible, but she just really didn't know how to get started with that. So then she got a handout during her group, and it came with a pretty simple game plan, 5 steps, easy enough, she thought. However, when she started to go through these steps and work them, she realized it wasn't easy at all. So she had reached out to one of her best friends who didn't vape, and she said that she was struggling. She said she felt embarrassed that she wasn't able to quit. She thought it would be way easier. But guess what? She must have reached out to the right person, because that friend was such a good support. She told her not to give up. She said it's okay that she slipped. And Mariah picked up and said, guess what? I can be your friend. I can help you. And later that afternoon, she texted Mariah and she sent her this text message. a free confidential texting program that's 24/7 for any teen, for any college student to help make their path and to help make some changes if they're interested. So Mariah thought she had nothing to lose. So she gave it a shot. She texted, it's free. She got ongoing supportive messages back from other teens who are also going through the same changes. You can follow them on Instagram. They have their own social media accounts. But the really cool part is it was teens helping teens, and it's evidence-based programming and messaging. So it's a really awesome option. If you want to put it out there, it's called This Is Quitting. So Mariah, when she headed home that day, so she's feeling good, she's got a game plan. She walks in the door and she sees her mom sitting arms crossed, waiting for her to come in to talk a little bit about that she's gotten in trouble at school. She's going through these groups. But you know what? Mariah's mom, she also did some homework. When she found out Mariah was going to be in trouble and have to attend and participate in this in-depth program, like all good moms, she Googled it. Google told her it was on the American Lung Association website. While she was there, she searched around. She found out some information for herself, how to talk to your teen about vaping, because she knew Mariah needed support. And her way of going about it, being an authoritarian, was not going to work in this. She needed to tell Mariah she messed up, but she also needed to tell her that she still loved her and she was going to be there to help her get through this. And she needed to let Mariah know that vaping's unacceptable in their house. Also, mom took the opportunity to make sure that older brother Mariah had, that he understood vaping is not acceptable in their house and in their home, and he needed to, she would want to help him get supports as well. But I put this on here just to remind us, it's not always easy to engage a teenager and have these tough conversations about the dangers that they're up against. But kids really do care what their parents think. So if we just take the time to have these conversations, to ask them about what they know. If you take something from today, ask them about the products that you learned about. Share, I learned this. Tell me, what do you know? Anything that's new to you, have a conversation. That's a great way to get started and move forward. So Mariah's mom took some action. Now that's going to lead us to our third and final action step for today, guys. All right, so we're going to use our words. We're going to talk about what tobacco treatment is not. We're going to use the right supportive words. And our third action that I'm going to ask you to do today is advocate. I want you to be the change that you want to see. If you heard one single thing today that made you want to learn more, talk more, do more, let's do it. I would love to partner. I'd love to collaborate. There's always an opportunity. Our young people need you, or maybe you have a partner or a friend or a family member that needs to hear some of this information. We can do it. But we have to do it together. One person is not going to get us very far. So let's talk about our next opportunity. If you want to join, we have a quarterly meeting for anyone who is passionate about this topic. We focus our 1 hour on what's going on in the community, what we need to support one another. It's a networking opportunity. It's coming up. It's going to be Tuesday, April 12th at 8:30 to 9:30. It's a Zoom meeting. And if you think I would like to do this, but my schedule doesn't permit me to attend a meeting, we have a distribution list. I promise I try not to send out more than 2 emails in a month, but it's latest and greatest kind of what's going on in the world of tobacco to keep you apprised of new products and what's out there. So if you're interested, please sign up with my email. It's Katie.Gassner, Gassner at mcbhc.org. All right. So the other thing that you could do to get yourself involved is cleaning up the neighborhood. So if you want to advocate, you want to make a change, this is a simple one. Earth Day is right around the corner. I have Lisa on the line. She was an adult that was instrumental today in helping this young group of true students. We did a litter cleanup in their neighborhood, but it was great just to hear them talk, to see the product. They care about the environment. So we talked about, look, these vape pods, look at all these packaging, what happens when they get into the environment? Where do they go? But this is another just an opportunity to engage young people. When I speak to True, I'm talking about the Tobacco Resistance Unit, something all over Pennsylvania that any youth can join. They just need an advisor, and then to connect back with me. 12 to 18 is the age group. This was a couple weeks ago. Laurel students and their nurse were working together to educate all of the 7th and 8th grade. And it was so impactful because let me tell you, peers love to hear from older students. They love it. They were engaged. They were paying attention. It was a great learning opportunity for all the parties involved. The older kids did a good job. They shared My Life, My Quit. They hung posters in their school. The posters don't get ripped down. They don't get defaced because it's teens hanging up their own information and others enjoy seeing it. We had a Sharon group that we just met. They did a poster contest and then their advisor reached out after we just did this. This is probably a week and a half ago. After they did this, they want to get more involved. They want to do more things. Next week, Sharon School District, a meeting, they're going to start their own true group. So tons of opportunities. You just have to have a willing adult that wants to take on the responsibility of wrangling some kids, and I'll help you organize and funnel all these great ideas and advocacy options that are out there. All right, so today for our review, we said our words, we're going to share and advocate. If you want to do more, those are the action steps to get involved. So I think we have a few minutes left for questions. I'm going to leave my contact information on the screen. And I just would like to say, I really appreciate your time today. I thank you for spending your lunch trying to multitask and listen. And I hope that we were able to broaden and build some of the tobacco knowledge that's out there. All right, Donna, do we have anything in the chat box we could check out?